discussion will be focused on the cardiovascular system, specifically the heart. So let's start here with a review of the anatomy. So first of all, the heart is a cone-shaped or inverted triangle organ found in the mediastinum within your thoracic cavity. The mediastinum is the location wherein you can find both the heart and the lungs and other important organs along the thoracic cavity. So your heart functions primarily as a pump. So the heart is surrounded by your pericardium, or also known as your pericardial sac. So this pericardium actually has two layers. You have your fibrous and your serous pericardium. So if you were to imagine it, your heart is being surrounded by a sac. So this is able to provide protection to your heart. So for the two layers again of your pericardium, you have your fibrous pericardium, which is able to limit stretch because of its anatomical structure. Fibrous meaning it's non-pliable. Then you have your serous pericardium, which has a double layer again. So for your serous pericardium, you have your parietal layer and your visceral layer. So between the two, the parietal is the outermost and the visceral is the innermost. Your visceral layer is actually already part of the heart wall. So this visceral serous pericardium is also known as your epicardium, or the outermost layer of the heart wall. Then, between your parietal and visceral layer, you have your pericardial space. So within your pericardial space, you also have your pericardial fluid. Next, let's proceed. So what else about the heart? So we have here the orientation. So again, diba, it is inverted triangle. Si base are sa babaw, si apex are sa talong. But more specifically, your heart base is located between the third and the fourth rib, and is oriented superiorly, posteriorly, and towards the right. You have your apex here, found at the level of the fifth rib, and it is oriented inferiorly, anteriorly, and to the left. So you might say that the heart is found from the third to the fifth rib. Next naman for the borders. So here we have your anterior border, tubang sang heart, is your sternocostal border. Sino ang tubangan ni heart? Si sternocostal pertains to ribs. So that's your sternum and your ribs. The inferior border is your diaphragmatic border because just underneath your heart is where you can see your diaphragm. Next naman, for the posterior border, this is also known as the base surface because diba, your base is located or is oriented posteriorly. So laban na base, makita mo sa posterior aspect of your heart. That's why si posterior at si base, the same silang ang border. For the right border of the heart and the left, of course, diba, it is being enclosed by your lungs. Okay, so sa right border, right lung, sa left border, you can see your left lung. Next, we have here a picture showing you what CPR looks like. Let's proceed with the layers of the heart wall. So your epicardium, so we previously mentioned, this is actually part of your pericardium, or ang sac na ka-enclose sa heart. So for the epicardium, this is also known as the serous visceral pericardium. So since this is the outermost portion of the heart wall, this is where you and for the middle layer, you have your myocardium. So this comprises 90% to 95% of the heart wall. So laban ng heart mo, muscle din siya. So this is because this is important. This is what allows your heart to act as a pump. So kaya niya mag-pump blood because 90% to 95% of it is made up of muscle. And lastly, you have your endocardium. So this is the innermost layer. Okay, so ano di makita mo? This is the layer directly in contact with the blood. This is the layer where you can find the valves of your heart that allow passing through of the blood. So this is it for the layers of the heart wall. So for the chambers of the heart, we generally have two chambers, general classifications. You have your atria and your ventricles. So both of these are paired, meaning may duha ka atria, may duha ka ventricles. Okay? So for the chambers of the heart, the atria are typically known as receiving chambers or primer pumps. Now let's discuss in the process of the blood flow through the heart. Si atria ang una kabaton sa blood, okay? And as well as sila ang una kapump sa blood. For the ventricles, they are also paired and they are known as powerful pumps because the ventricles, paired again, di ba? Si right ventricle pumps blood to the lungs and your left ventricle pumps blood to your system. So they are known as powerful pumps because layo ang kailangan nila padalan sa blood. What else? So the atria have thin myocardium while the ventricles have thicker myocardium. Because si atria again, primer pumps sila. Where do they send blood to? They send it within the heart lang mismo. So they don't need to have a thick layer of muscle. Gamay lang, may gamay man ang ilang workload. When you're talking about your ventricles, thicker sila because again, they are powerful pumps. And specifically, mas powerful si left ventricle because it needs to get the blood to the entire systemic circulation. So si left ventricle, pa-systemic, thick ang dua ka ventricles, but in general, si left ventricle has the thickest myocardium. Okay? So to proceed, we also have here the valves of the heart. So what are the valves? These are parts of your heart that open and close and allow blood flow or don't allow blood flow. So kung open sila, nasulod si blood. Kung close sila, hindi ka-pass through si blood. So we have two classifications of the valves. You have your atrioventricular valves and you have your semilunar valves. So for the AV valves, near to dua, you have your tricuspid or the right or found on the right, and you have your bicuspid or mitral found on the left. For your semilunar valves, you have your aortic and your pulmonic valve. So this is a diagram of one of the valves of the heart. So this is an open valve, and as you can see, ang flaps niya go down. So kung mag-open ang valve, open na siya because of pressure or volume of blood. So kung dano ang volume sa atria sa babaw, what will happen is that it will force the valve downward to open. So kung open siya, manaog siya, then blood can pass through. Manaog siya sa ventricles. Okay? So for the structure of the valve, we have here your chordate tendineae. So the variety and spelling, just check your books. And you have your papillary muscles. So the chordate tendineae are the tendon-like structures that attach to the valves. And the papillary muscle, ang muscle na attached kay chordate tendineae. So passive process ang pag-open sa valves. Your papillary muscles and chordate tendineae are just there to ensure na it is stable. Your valve is stable. Okay? And mag-close naman siya. So, di ba, open si valve, masulod din si blood. Once mag-fill na niya siya with blood, the pressure here will push the cusps of the valve upwards. Di ba, pag open niya ang may, pag-close siya, mapuno, masaka siya. How the valves open and close. Now let's discuss your heart as a pump. So for the heart as a pump, there is two classifications. You have the right side and the left side. Further, you have two circulations in your heart. You have your pulmonary and systemic circulation. So typically, your pulmonary circulation, nilabay sa lungs, it loads oxygen and unloads carbon dioxide. While your systemic circulation loads carbon dioxide sa blood and unloads oxygen to the tissues. So this is typically your two circulations. So now let's discuss blood flow through the heart. So as we discussed here, dua ka atria nga paired, you have your right and your left atria, so abbreviated RALA. Then you have two ventricles, right and left paired again. right ventricle, RV, left ventricle, LV. So let's follow the blood flow, starting from your superior and inferior vena cava. So the blood coming through your superior vena cava and inferior vena cava are both deoxygenated. Means na deoxygenated, kaya because nahatag nila ilang oxygen sa tissues. Okay, so after nila supply sa rest of your body, sa entire body, it goes back to the heart. Because again, this is a circulation. So, ibot-ibot lang, balik-balik. So for the superior vena cava specifically, so this is the oxygenated blood from the head, face, and neck, and from your upper extremity. Ano na superior siya. Babaw. Next, we have your inferior vena cava. So inferior, the low, no? So from the bottom half of your trunk and from the lower extremity. So mag-range siya kay inferior vena cava and go to your right atrium. So diba, your atria are receiving chambers. So nabaton na siya, unang baton sa blood. What else? Your right atrium also receives the blood, the oxygenated blood, through your coronary sinus. This is from your coronary circulation. Next, let's follow the blood flow. So from the right atria, it will send blood to the right ventricle. So this is the right side of the heart. It goes through one valve known as your tricuspid valve. So para itong malipat, diba, you write it as tricuspid or tri is right. After passing through your tricuspid valve, it goes to your right ventricle. From the right ventricle, it needs to give the blood to the lungs because your right side, diba, sends it to the lungs. So this is by way of your pulmonary artery, and you also have one valve here known as your pulmonic valve. So blood getting into the lungs becomes oxygenated and will pass through your pulmonary veins. Meaning, ang galabay ng blood, the pulmonary vein is already oxygenated. So from the pulmonary veins, it will drain to your left atrium. Following the flow again from the left atrium, it will give the blood to the left ventricle and pass through your bicuspid valve. So from the left ventricle, it will send or it will pass through your aorta, passing through one valve again known as your aortic valve to send the blood to the rest of your system. Kung halin naman yung system, diba, i-give naman si oxygen kay tissues, paano sa carbon dioxide, and eventually, mabalik naman sila kay superior and inferior vena cava, and thus continuing the circulation. So for reference, ako niya siya ang diagram na naubra for easy visualization and remembering. So the blue valves are considered atrioventricular and the green valves are semilunar. So si AV valves, tricuspid, bicuspid, si semilunar, pulmonic, and aortic. But in actuality, so this is how closely related the structures are. So si atria and si ventricles, lakitay lang sila in actuality. Okay, so ang iniya diagram, not anatomically correct, but for easy visualization of the flow lang siya. So this is it for the blood flow through the heart.